Welcome back to the Next Appraisal Tool modules. This module addresses question 17. Are the results of the statistical analyses clearly reported and interpreted? The answer to this question will be in the article's results section. Considerations when answering this question include, if a hypothesis was stated, do they clearly report whether the null hypothesis was rejected? If a research question was posed, how do the results answer the research question? If only a study purpose or aim was stated, how do the results address that study purpose or aim? When reporting results, authors typically start by describing characteristics of the sample. This is often the first paragraph of the results section. When a study has two or more groups, they should report whether characteristics differed across the study groups. Table 1 is from a randomized control trial testing the efficacy of a multi-level behavioral intervention initiated to improve low-income maternal smokers' abstinence and reduce child tobacco smoke exposure. The table shows participant characteristics in the control and intervention study groups. While also reported in the text, tables should show you how many subjects were included in the analysis. Sometimes it's included in the title of the table. An uppercase N indicates total sample size. A lowercase n is sample size for each group. This table clearly indicates the sample size in each study group. For example, the control group included 197 participants. Another column, or right below the sample size, we see means and standard deviations, or a percent. These authors do not state the predetermined p-value selected to indicate statistical significance in the methods section, where it can often be found. In this study, authors describe results as statistically significant when the p-value is less than 0.05, a common p-value to use. The text of the results section refers the reader to the consort diagram, or flow of participants through the study, to illustrate participation rate and attrition rate at each data collection point. Differences in attrition can create study groups that become less similar over time and may impact the results. The results might be biased when there are differences. When there are differences, you do need to ask yourself, what might have caused this difference? If the intervention group had a higher attrition rate, then the intervention may not be well liked by the participants, or it may simply be difficult for them to engage in the intervention. This is information you will use when deciding whether or not to replicate the intervention at your setting. The text in this study also refers the reader to Table 1, but does not explicitly state statistical differences. In this case, the problem drinking with a p equal to 0.028. However, in the analysis section, the authors discussed potential confounders and stated that there were differences in alcohol problems and that this variable would be controlled in the regression analysis. You also have to evaluate if the results in the text match the information in the table or the figure. If the information is not consistent, then you need to make a judgment about the credibility of the results. These investigators conducted an RCT to evaluate the efficacy of an interactive, web-based sexual health program for developing sexual assertiveness skills and enhancing sexual decision-making in adolescent girls. They assessed participants at pre-test or baseline, immediate post-test, and 4-month follow-up. The table shows the sample characteristics that were also described in the text of the results section. The table is well labeled with sample size for each study group, use of means and standard deviations, and a column for the p-values. Below the table, they remind the reader about the types of statistical tests conducted, and it reinforces the text that they use the correct test for the type of data analyzed. In the text, the authors clearly and succinctly describe participants and indicate the statistical differences between study groups at baseline. In an earlier section of the text, they report the study flow diagram, and in the results section, they report retention rate and reasons for statistically significant differential attrition between study groups that are very reasonable, and that there were no statistical differences between those who dropped out and those who were retained. This supports validity of the results. These investigators conducted a secondary analysis of WIC program data to estimate differences in breastfeeding initiation rates between African Americans and Black immigrants enrolled in the District of Columbia WIC program between 2007 and 2019. The text above the chart is the first paragraph of the results. Authors provide a very clear and succinct description of participant characteristics, making it easy for the reader to understand who the data represent. This will also assist the reader in determining whether study findings apply to the population they serve. Then the authors describe their outcome of interest, an average of 48.6 breastfeeding initiation rate, and percentages by race, ethnicity, ranging from 39.9 to 77.7. Looking at the chart, authors use line markers to make it easy for the reader to follow the different study groups over time. The text to the right of the chart clearly helps the reader interpret the chart by discussing the differential increases over time. Authors also define the p-value and report the confidence interval used to determine statistical significance. These results are from a study that assessed variability in annual chlamydia screening rates across a large pediatric primary care network and determined the influence of patient race and ethnicity on the screening outcomes at the patient, clinic, and individual clinician levels. In the analysis section, the authors clearly describe using different models to examine the influence of patient and clinic characteristics. Table 2 shows the results of examining the impact of patient characteristics, shown as the first bold table header, and then the clinic characteristics, the second bold table header, on chlamydia screening. They used mixed effects logistic regression models and estimated odds ratios accounting for random effects of patients and clinic sites. Mixed effects refers to taking into account fixed and random effects. A fixed effect does not change, such as our race. We know all the categories of race, and our race over time does not change. A random effect is expected to vary in the larger population, such as there are wide variations in clinic size or number of clinicians at each clinic. Use of random effects supports inference of the study results to the larger population. The investigators' use of logistic regression is appropriate because the outcome of interest has two categories, a dichotomous variable, in this case, whether screening was conducted. Text in the results section clearly describes the significant relationship in the model and interprets the adjusted odds ratio. The term adjusted indicates that they controlled for covariates or potentially confounding factors. Again, this further strengthens our trust in the validity of the data. You might remember that when determining if an odds ratio is statistically significant, if 1 is in the confidence interval, the estimate is not statistically significant. Data are typically coded so that an odds ratio of less than 1 indicates the independent variable lowers the odds or chance of the outcome, while an odds ratio of greater than 1 illustrates the independent variable increases the odds of the outcome. For example, in the patient characteristics model, the odds ratio for age is 1.23 and the confidence interval does not include a 1. Therefore, older age increases the odds of screening. The authors also show us the sample size. It's reported below the table. Congratulations! You successfully completed this module. You may return to the main menu or continue to the other appraisal modules and the next EVP course.